Hello everyone, joining from online and here. So today for the next 15-20 minutes, I'll be speaking about how technology and implementing it within the social care sector goes beyond creating the technology in itself. It's about people and their mindsets. So we will be exploring 3 different case studies with applications in virtual assistant, robotics, and apps. And through these case studies, we will look at the barriers and opportunities that digital technology has been bringing to the social care sector. So let's get started with virtual assistants. So actually the buzz around chatbots and voice assistants has been a lot over the last few years. But because of this buzz, it's quite easy to forget that chatbots are actually as old as computing in itself. So the first chatbot was created back in 1966. It was a computer program called Eliza, and it was based off a fictional character called Eliza Doolittle. So this was created in MIT Artificial Laboratory. And this 200 line of coding basically modeled active listening, which was to represent person-centered therapy. So it's really interesting that the first application within healthcare of chatbot was in healthcare, which has been quite slow in resistance in adopting chatbot in itself. And the next one that came along was Perry. So that was in Stanford University by a psychiatrist called Kenneth Colby. And this computer program modeled a person with schizophrenia. So again, a healthcare application. Since then, there have obviously been a lot more virtual assistants that have come into the market and made its mark. But I think the real turning point was when Apple brought in Siri, because for the first time, users could interact with machines using voice. So you got Google coming in with Google Assist and Microsoft with Cortana. And then things got really interesting when smart speakers got into the market. And there was this next level of interest and buzz around using virtual assistants. So with Amazon bringing in the Echo and Google with Google Home, a lot more industries started adopting this piece of technology. You also had technology in itself, so better cloud computing, voice recognition, all of these other things got better as well. But still, there's been limited usage within the health and social care space. So why is learning about the history and evolution of chatbots or virtual assistants important? I think learning the history gives you an insight into user behavior and the way the market is behaving as well. So if we look into the social care space, which is resistant and slow in its adoption, we can start understanding why is it like that. So before, because technology has improved since 1966, we tend to forget that people and organizations have had really frustrating and struggled with this piece of technology. And so you've had chatbots that were unable to process human language. You've had not enough data for chatbots to complete complex tasks from the user end. And because of this, users were misunderstood, sent in loops, had errors that were given to them, and of course that was really, really frustrating. Now put this in context of social care. You have customers who were basically going through this buying process, which took a lot of resources, had a learning curve of deploying it in the market and having people use it. Now if they were struggling and experiencing these bad experiences, it just means that it takes a lot more effort to bring their confidence and trust back into this piece of technology. And that said, with COVID there has been an increase in uptake of certain solutions like this. So for example, within the mental health space, you have chatbots delivering cognitive behavioral therapy, which has seen a pretty nice uptake. So you have for depression, anxiety, PTSD. A lot of chatbots are being used for care and education around COVID. And then countries like Germany are bringing in digital prescription of these solutions. So healthcare professionals not only can prescribe drugs and medications, but they can prescribe digital solutions like this. And so it means that the awareness and accessibility to solutions like this increase in a country that enables something like this. So the main takeaway here is the technology can be great, it can be seamless, but without understanding the customer's experience and interactions with the market, it can be quite difficult to understand why there's limited uptake. So the second case study that we will be looking at is robotics, specifically social robots that help older adults with well-being and independence. So the one that you see on that side, the right-hand side, the Eli Q is a elderly assistive companion robot. And it offers companionship, entertainment, fun games, communication with the elderly, but it also helps them attain their health and well-being goals. Now the one on this side is a home robot by OmniLabs, and it helps people connect to their families and support system. Now, the benefits of these social robots are evidenced by studies that were conducted by universities in the UK and Italy, and it was actually one of the largest of its kind, where they looked at the impact of these social robots on care home residents. And these trials showcase that if the robot was able to communicate and provide a level of companionship alongside actual carers, you saw a positive impact on their mental health. And it also has a potential to reduce loneliness in the elderly. So this kind of gives us an insight on what the future of social care could be. Now the emphasis on could, because there's a lot of stigma around using social care robots in this sector. There's a lot of negative kind of perception attached to it. And it's mainly because caring is such a human element. There's so much humanness to it, empathy, human connection. And so when we look at these robots, we need to think, what is the actual role that robots need to play in this entire process? There was a research done by European Commission where they surveyed EU citizens, and 86% of them said that they wouldn't be comfortable having their elderly parent looked after by a robot. You also had the founder of the OmniLab saying that while they think personal robots are really cool and super normal, a lot of people still look at this in a very novel way and are still warming up to the idea of the role that it can play in the care process. So I think we know the potential benefits that robots can play, but I think we're a long way away from it actually being implemented within the industry. And I think one of the ways that it could enter is through the ones that help with the physical aspects of care. So for example, if it's helping someone eat their food, that means that person can maintain their independence at home. It also means that the carer has freed up time to provide other meaningful activities. So that's one of the ways I think it could enter the space before even companionship robots come into play. So again, the second takeaway is the technology, again, can be great, but really understanding the user acceptance and the market acceptance, it becomes really important. So the next case study is on something that we're working at CogniHealth. So I'm the founder and CEO of CogniHealth, and the aim is to support families that are affected by neurological conditions. And we do this through building digital solutions, and our key focus has been on dementia. So we've been working on dementia because it's one of my personal and professional motivation. I was working and researching on Alzheimer's disease and looking at memory loss, but this was kind of away in a lab, distant from the actual realities that families faced at home looking after their loved ones with dementia. And I think it was interacting with carers in one of the conferences that I finally understood what those challenges look like. And then my grandfather got diagnosed with dementia as well. So again, it kind of paralleled in terms of my motivation to support families that were struggling with this. So after that, I took a job as a carer. So if I wanted to solve these problems, I really needed to understand on a ground level what was happening. So through my caring job, I kind of found two fundamental problems that I wanted to address through CogniHealth. So the first one was families were lost in a sea of information, not really knowing where to go, what to do, who to contact. And so in response to that, we created our flagship product, which is called Cognicare. So it's an app, a digital companion for carers looking after their loved ones with dementia at home, and it provides end-to-end dementia care support. So right from what is dementia to delivering dementia care, financial, legal, therapeutics, self-care, kind of the whole aspect of dementia care in one place, which means that they don't need to go down the rabbit hole of Google of understanding where they need to go and what they need to know. And it's personalized as well, so the more that they use it, the more we understand where they are in their journey, and based on that, we can point them in the right direction. So this solution, we created it by working with affected families. We worked with universities and academics, with healthcare professionals. So we worked with different stakeholders involved in creating this. And we were able to publish a paper that showed our evidence-based approach in developing a solution like this. So we have about 5,000 users, and it's great to see the impact that we were able to make. Now, the second solution, or the second problem that we wanted to address, was as a carer, I was going into the client's house delivering care and writing care notes in a notebook. Now, this notebook was basically tucked away in a cupboard after I left, and it was picked up maybe once a month or twice a month and then filed away. So this information about the client and the data around it was basically just a dead end at that point. And this became really prominent when one of the ladies I was looking after lost a lot of weight and was hospitalized. So of course we knew she wasn't eating as much because we were the ones providing the food. But while this was noted, nothing was done about it. And I think it was this aspect of actually something could have been done, the intervention could have been put in place before that hospitalization occurred. So I went to the care provider with a solution to track and document what was happening and using this data in a much better way than it was before, but didn't really get anywhere a few years ago. But I think since the pandemic, the social care market has opened up to innovation and taking on new technologies. And we think based on our experience of building Cognicare, we're able to look at building the solution and take on this business proposition. But we did it slightly differently. So instead of going to the care provider with the solution, we partnered up with one. We did user research, initially interviewing care staff, managers, the CEO, and kind of validated the problem statement that we thought we knew. And it also provided insight into their operations. How do the care workers operate? What happens on the field? And once the problem statement was quite clear and an understanding of their organizational structure, we were able to do ideation workshops. So how would the solution function? How would it look and feel, the design of it? How would we deploy the solution with different service areas? What was the infrastructure that they had? What kind of training did they need? And based on all of our research and findings, we then created a clickable prototype. Now this prototype, again, we saw how they used it, how they interacted with the different designs and different functionalities. Until this point, we haven't written a single line of code. So we did all of these different steps before we even started building it. And only after that did we start building the product out and now have a pilot with the care provider that we've partnered with. And so we got a financial buy-in in the middle while we were doing the clickable prototype, which was great. But we also got the end user buy-in. We got the care staff wanting to use it because they were a part of building the solution. They were the ones benefiting from it as well. So it was really key that you get the staff buy-in, not just the organizational buy-in as well. So how does this app work? And so what it does is it unlocks kind of the data behind closed doors that we still don't have access to. And it uses this to benefit the patients and the care workers. So they're able to post just like they would with care notes, but in a more interactive way. They're able to either speak to it, type, image, whatever form of digital capturing that they want to do, they're able to do it. These notes can be then searched for, reacted on, and this is all in real time. And they don't need to spend time during the care session documenting notes. They can do it on the go to the next client's house or even after. The other thing that it enables is to understand their clients better. So while they might have briefs on each of their clients, it might be quite medical and quite lengthy. We provide a way where they can add to the summary of the client, saying, you know, how do they like their cup of tea? What do they like to be called? It's these things that enable better care, especially when there's shortage in care staff. The rotational of them has increased and they don't know the clients very well. So this provides a way for them to get to know their clients even before they enter their homes. And finally, it's an educational tool as well. So if they have a client that they're looking after that has dementia and they've never worked with someone like that, they can access our advice section and understand different symptoms, how can they react to it, what they should be doing, and again, all of this while delivering care. So the third takeaway I would say is to have a person-centered approach, to bring the users and all the stakeholders that are involved in the product that you're creating right from the beginning. And I can say that from experience because the way we've approached it a few years ago towards how we've taken it now, I can see that difference. And you learn a lot, that the kind of presumptions that you make of what you want it to look like versus what the end user wants it to be, you kind of start seeing those differences. And so after kind of building these solutions, we've had a really great response from the market and opened a services arm of CogniHealth over the past year and a half. So we've worked with academics and healthcare professionals who have an idea of bringing a digital solution to market. So we write from user research, design, understanding who they want to build a solution for, all the way to deployment, development of the solution. So we've worked with NHS, we've worked with universities, and I think what the USP that we have from a services perspective is the science, not just the tech, and we come at it from a user perspective, so knowing what carers are going through, knowing what healthcare professionals' work ethic looks like, academics, again, using data for research. One of the things that we're doing with Cognicare as well, understanding a little bit more around dementia care through the back-end data, of course, is anonymized and everything. But again, a great way to do research as well. So I hope I was able to provide a different perspective on technology, and if there was anything that any of the work that we've done or anything that I've said that's interesting, I'm happy to have a conversation. And if anyone has any questions, please let me know.
Pooja, when you were doing the ethnographic approach and embedding yourself in it, and then you went back to the authority to see how they provided care, did they accept some of your learning as well in changing their processes to provide better care?
Yes, because it was coming from the voice of their staff members. So it's one thing me saying, you know, it's done this way, another with the people who are working within the organization voicing the same concern. So it was much easier when it came from the organization in itself than me trying to convince them that it could be better. And I think that was the approach that helped us, especially with, you know, the first customer. It can always be quite tricky to you know, showcase the problem statement and then the solution. So. Yeah.
That's really interesting. I've actually got that app on my phone and not used it. So that's my dad has dementia, so I'm going to use it now. So that's absolutely fascinating to meet you. I'm a data protection lawyer, so lots of personal data issues, and I think the pandemic has highlighted lots of data sharing issues that have been complicated, overcomplicated sometimes in my opinion, and also trust issues from individuals whose data is already being shared quite a lot and they just didn't realise it. So I'm really interested to know, obviously people are putting data into your app and you're getting information out and you talk about anonymized data. How would you then, or how do you share data through, particularly the example you gave of the care provider? And you know, it's a huge issue in social care, that sharing of data. How does that work?
Yeah.
Do you share data with other health organisations? So there's such a platform.
Yeah, so within care providers, so one aspect is when you look at it from a care staff perspective and them accessing the data of clients. So we're doing a few things there. One is making sure it's password protected, so each person has their own account, and that's linked with only the clients that they are looking after, not all of the client list. So we match the care with the client list to make sure that that's protected. Again, we have data stamps of when they're logging in, logging out, when they're posting. So that sort of data is open for the organization to see if they want to ever look into anything. So because they can add in data into the app about a client, so it's really important to get that timestamp of who's writing what and where. So that's from the care staff point of view. And then from the family point of view, ensuring that their kind of data is not going outside the organization. So we wouldn't ever share it with anyone else. It would be used for documentation purposes, and it sits within the care provider, their organization.
But what if there was, you know, the example we gave of the woman who was losing weight? You know, it's in your app, but someone needs to know about that to help that person. So how, you know, it strikes me that as a family member, planner, as a data protection lawyer, I expect that to be shared with a doctor or some healthcare professional so that they will help them.
Yeah, so one of the other, so there's two things that are happening. When something, let's say, is red flagged on the app,
Yeah.
the manager gets to know and the care staff that are looking after that client gets to know. The second thing that we're doing is building a solution for the family, something like Cognicare, where the care staff can communicate with the family. Because at the moment, though health and social care are joining up and it's coming together, it's still quite separate, and it means that care providers don't actually communicate with hospitals. So this way, families actually have a platform of notes of what's happened, when it's happened, and that can be shared with the doctors or nurses that are looking after, because we found it quite difficult, especially as a small startup, to engage with NHS to sell them a product and integrate with their systems. So we believe that through this manner, the data sits with the care provider, it can be shared with the family and only a certain member, and they have then the option to share it with who they think is important to share it with.
Gosh, that's really interesting. And also far too cumbersome. But I understand that's the solution.
Sorry, because I wasn't here at the very beginning, so you may have answered my question before two slides. I'm interested in the same problem space from a personal point of view and a professional point of view, but care homes are a whole other kind of gig, aren't they? And often what people would like to know is simply activities and things that the person's been able to enjoy and so on. And that kind of information, you know you're taking somebody's time to try and find out how the person's getting on, their day, whatever. Do you also see your potential activities on the periphery, maybe when people are in a different care home environment, that some of these technologies would start to also enhance and add to the understanding of what's going on with you as well? Yeah,
doing activities like, so one of the things that we have within this app is actual activities that let's say care home staff can engage with. So let's say yoga, there's a video on doing yoga together, chair yoga, especially for the elderly. Now that can be tagged with a particular client through the app. So it means that it's personalized. So when a new care comes in, they know what that client already likes to do, and it's saved within their profile. And that is known, and their engagement with that activity can be captured. Is that the context you were asking?
So basically, care in any setting.
Yes.
Is that the whole? So it seems to me that the whole model has got huge capability because as a family member, you spend a lot of time. You say, "Well, I'm phoning up. I'm just going to ask what her mum did because she's got dementia."
Yes.
She won't remember what she did. She'll say, "I don't know."
Exactly.
And then it turns out she did art and a poetry club.
That's one of the
problems. And you must talk about the art and poetry club, even she won't remember, but then you're taking one of the nursing cares. But then to check, oh, mum did art and poetry today. Really, and it's such a simple mechanism to just have the journey.
Yeah. No, I mean, you've outlined the problem perfectly. That's what we got from the care staff as well, saying, we've provided the client with food, but then when the family members come in, they say that, I didn't eat all day. And so it comes back to the care staff saying, why didn't you provide food for my mom or whatever? And so this way they can either document this, take a picture of them enjoying their food, whether, it's ice cream after dinner or whatever that looks like, and be able to share it in a positive way rather than say, oh, there's evidence that I've given it. So again, it's kind of the delivery and communication methodology that we pay attention to as well. And I think that would work in a similar manner with care homes where families are distant or can't visit their loved ones as frequently and understand what's happening with their care. They can actually document the care for themselves, but be able to share certain aspects of it with the family.
What's your plans for rolling out and growing?
So we are finishing the pilot early next year. So the idea is first to deploy it within the care provider that we've partnered up with in Scotland, and then around about that time start looking at other care providers to showcase hopefully the success of the pilot and the impact that it's made. So we're looking at one area in Dundee to expand it across all of their 10 locations, 12 locations within Scotland, and then look at similar care providers with the model of, same place in terms of their size, technology level, acceptance. To start profiling similar care providers to who we're working with today.
Do the individual carers use their own devices, or is
So what we're doing with this care provider is for the pilot, we're providing the devices, we're doing it for Android. It's just easier to control and understand what's working and what's not to improve the product. But at the end of it, I think it's up to the care provider if they want us to supply them with the phones and package it differently, or do they want to buy it themselves and they're quite confident in choosing a type of smartphone for their. So it would be a work phone, it wouldn't be on their personal.
yeah, that would
Yes.
probably be. Yeah.
Because right now, I mean, they get emails into their inbox on their personal phone with all of the data around the client. So this provides a much safer way to even access client data that's not stored in email.
Yeah, I totally agree, and it's not a scary bit of paper in some industries.
Yes. Yes.
I was thinking a bit about kind of measurement and how you measure success of the app.
Mhm.
Obviously, you can speak to the carer and people like that, but do you take any feedback from the client? And it must be difficult, having dementia themselves. But is there a way you can measure feedback from the client themselves or get them involved in the development process?
Yes, so especially with Cognicare, sometimes it depends where the person with dementia is on their journey. But if they're at an early stage and they want to participate, we've had them come into the workshops and look at the design and feasibility of the way that it looks and feels. In terms of care and share, we haven't done that with families just yet, just because of where we are in our journey with the product development. But we want to, especially because it's going to, the end user that's going to benefit from this are the families, and we want to take a kind of understanding of where they are today versus, the impact of the 6 months down the line. And I think the care providers are quite open to recruit families on our behalf and get their buy-in in terms of they will also have an app soon enough developed for them that would, they would get all this information about the person that they're looking after. So it should be pretty easy enough to. Yes.
Hi, Julian Dickles, Salt Stereo. Just a quick question, looking at this from the perspective of government and also from the perspective of digital identity. And so how do you authenticate, who do you authenticate with? How do you assure the identity of all the various parties that interact?
So it's up to the care provider to provide us with that information. So their current processes are, they have a client coming in from the local authority, or as a private client, they have the documentation of where they come from. The care plan is done by the social care worker. Again, they have that documentation. So in terms of the pilot, we're using that sort of information, putting it in a data sheet, which can then be uploaded to the app. But we will provide eventually as an end-to-end solution management platform for them to authenticate who they're uploading, who the clients look like, and all that sort of information that they normally would do.
So slight follow-up question if I'm hearing. So would that then possibly interact with the third sector and allow some way of voluntary input into the care setting?
I think that's when it gets complicated, because then you're looking at who has access to that data. You want to control who, or at least know who's accessing the data. So when you have the client, the family, the client, and the care staff, it's pretty well controlled in that environment. The minute you try to interact with the health and social care system, that becomes slightly more complex. Would love to figure out how that would work, because that's where we started in, but we haven't found solutions just yet into making sure we grow it in that direction in a protected way.
Thank you very much.
Thank you.
Thank you, Pooja, and Pooja, I'm sure we'll be around for conversations upstairs. And that's the end of our first session. We've now got a 10-minute changeover. If anyone's changing rooms, you can do that now. Thank you very much.
Yeah.